All right, so I'm Dr. Jeff Jarvis. I'm the EMS Medical Director for the Williamson County EMS system.
And I'm Mike Knipstein. I have the privilege of serving as the Infection Control Officer for the Williamson County EMS system also.
Howdy, y'all. So I've been getting a lot of questions about the flu, and since I'm an emergency physician and our ERs are absolutely overrun with people who either have the flu or are worried about the flu, I figured we would bring in our infectious disease expert, Mike Knipstein, and ask him some pretty common questions about the flu. So we want to get this pretty much to the point, so I actually wrote down some questions, and we'll just do a pretty quick interview. So Mike, thank you for joining us here in Theater de Dan. And so why don't we start off, tell us about the different types of flu, and what are they, and why should we care about the differences?
Sure. Well, basically, you're going to hear there's two different types of flu. There's a type A and a type B. The reason that is important is because the vaccine covers those different types of flus. So the vaccine that everybody here got covers three different types of flus. It covers two of the type A's and then one of the type B's. So that's the reason that that's important. And you'll hear, that covers type A, that covers type B. There's another vaccine out there that covers two type A's and two type B's. That's pretty uncommon. We usually do the one that covers the three. So that's the reason that's important. We need to know the different types of flus and what they cover. The other important part about that is again, that flu vaccine covers three types of flu viruses. There are hundreds of flu viruses that are out there. So we'll talk about that here in a little bit about why you can still get the flu with the flu vaccine. But again, this year it covers three different types of flus, two type A's, and then one type B flu vaccine.
Now, I've heard a lot about the type of flu that only affects chickens and the type of flu that only affects pigs, like swine flu and avian flu. Did I have that right? We don't have to worry about it since we're not pigs or chickens?
Correct. You got it. So they don't cross over per se. Usually if they are going to cross over, it's way over there, and we're much ahead of it because the flu virus originates in Southeast Asia and then kind of migrates over here. So we're aware of that, but the chances of that crossing over now. We're not a pig or a chicken.
So we can still get it, but we have some lead time and hopefully get it incorporated into the vaccine.
Yes.
Okay. All right. And H1N1. So I've been seeing a lot of H1N1. Was that included in this year's vaccine?
So this year it was. You heard H1N1 a few years ago, and you heard novel H1N1. Mm-hmm. The reason because it's novel is because that's the first time it's appeared. H1N1 has been around now, so they actually incorporated it into this year's flu vaccine. So you're covered on the H1N1 that you hear about now. Good
deal. All right. So, I hear a lot of people asking why the flu vaccine doesn't work, and they'll typically use it as a comparison smallpox. So, well, the smallpox vaccine works. Why doesn't the flu vaccine work as well?
Sure. Go back to what I said earlier. There's hundreds of different flu viruses. So you may have gotten one that it didn't cover. Again, the flu vaccine that we have now, they took an educated guess several months ago, about a year ago, as to what flu viruses were going to be around. And again, they got that because the flu starts earlier in different parts of the world, so they take an educated guess. They have manufacturing. They do all of that. So you may have gotten the flu that wasn't in part of the vaccine, completely possible. The other thing is just because you get the flu vaccine, again, there's more other flu viruses out there. And what was the second part that you asked?
So comparing it to, say, smallpox.
Oh, yeah, smallpox. Well, the difference there is flu vaccine in past years and even this year, what they show is only about 47% of the population actually gets the flu vaccine. Higher in kids, lower in adults because kids go to the pediatrician.
Right.
Only 47% got the vaccine. Smallpox, very different. 100% of the population got the vaccine on that. Lined up, give you the vaccine whether you want it or not. We don't do that with the flu vaccine. So if only 47% are vaccinated, that leaves the other 53% that can actually get the flu. So that's the difference there. Is the difference between herding everybody in, getting the vaccine, versus it's a voluntary thing. About 47% of the population gets the vaccine then.
Well, it is sort of an interesting contrast because back when we were doing the smallpox vaccine, I was one of the last people in my generation to get it because I was an Air Force brat, and everybody on base got it. A whole lot of people, I think a lot of our medics probably didn't get smallpox vaccine. Why don't we need smallpox vaccine anymore in America?
Great question. Because we eradicated it with vaccines. 100% of the population got the vaccine, the virus went away.
Had no place to go.
It's gone. It can't transmit from person to person anymore, so we stopped it. Flu vaccine, again, smallpox is pretty much the same virus as it was many, many, many years ago. Flu is different every year. That's the reason we have to get a flu vaccine every year, because there's hundreds of different flu viruses. It's a different one each year that's the prevalent one.
So it seems to be, it mutates a lot.
It's a smart virus. It's probably one of the smartest viruses that's out there because it mutates, it changes. There's different ones that pop up and stuff.
Fair enough. So I had an opportunity to teach CPR to a bunch of sophomore high school students the other day, and they said, well, wait a second, you're an ER doctor, you're a paramedic, so tell me about this flu thing. I got the flu shot, and then I got the flu. I didn't think that was possible. Can you tell me about that?
Yeah. They mean one of two things from that. I got the flu shot, and I actually did get the flu. Again, like I said, we cover 3 flu viruses with this vaccine, so you may have gotten one of the other hundreds that are out there. That is entirely possible. Or it means I got the flu shot, and a couple of days later, I got the flu. You can't get the flu from the flu shot. It's an inactivated virus. So it's impossible to get the flu. What you had likely was an immune response, which is completely normal. If you go to your doctor and you get the Tdap shot, your tetanus, diphtheria, and the pertussis, a couple of days later you get a little sore, low-grade fever. That's an immune response. That's completely normal. That's what a lot of people will get after they get the flu shot. They have an immune response. Low-grade fever, achy for a day or two, my arm hurts. Okay, now I feel better. That wasn't the flu. That's just an immune response, completely normal.
All right. So, again, you can't get the flu from getting the flu shot. How about if you get the flu shot, can you get the flu from somebody else? Somebody else gives it to you.
Sure. Again, if they have one of those flus that's not covered, one of those 3 that's in this vaccine, they can certainly give it to you. The chances of that are pretty slim. Even in our business where we're in people's faces and stuff like that, it's pretty slim. If you get vaccinated, you wash your hands after you interact with that patient. You keep an arm's distance away because, again, flu is a droplet borne. So if I cough or sneeze, it goes out about that far. There's a reason I'm sitting this far from you, because I don't want you to cough or sneeze on me. But if I get real close and you cough right directly in my face, there's a chance of exposure. Doesn't mean infection, but I got exposed to it.
Okay. So this is probably not the time to be hugging your patients.
Don't hug your patients.
Okay.
Side hugs only.
Side hugs only. Okay. See, good advice. This is the reason we brought the expert in. All right. So 3 things that are out there in the wild. We got the flu. We got the cold. We got the cedar fever. So how can I tell them apart?
Great question. Cedar fever, your eyes itch. You normally don't have a fever with cedar fever. It's kind of odd. Watch the cedar counts. You know that you have cedar fever. I have cedar fever. I wake up every day and want to scratch my eyes out. That's cedar fever. Difference between the common cold and the flu, good question. Really don't know. You really don't know. Sometimes people will say severity, but it's even not that, because you can have a really bad just cold, and you don't know if it's the cold or the flu. But if you're running a fever, you've got a cough, you don't need to come to work. You don't need to take care of patients. You need to kind of keep yourself away from other patients, and we'll talk about how to protect your family and stuff here in a little bit. But you really don't know. That's the problem with it.
Fair enough. So one thing that we didn't talk about a little bit is flu testing. So I just want to toss that in there. A lot of people say, well, the easiest way to tell the difference is just do a flu test. Well, so it turns out there are some problems with that. There is a flu test that is very accurate. It's called PCR, polymerase chain reaction. It takes about 2 days to get back, by which time you're probably better anyway, and costs about $300 to $400. Very expensive. The rapid flu test, which is what everybody does, they suck some snot and then run that on like a little pregnancy test, so a quick point-of-care test, turns out to be horribly inaccurate. And it becomes more inaccurate the older you get. So if our hospital won't even run the test, they refuse to let me order it. Well, they say I can order it all day long, but they're not going to run it on anyone over 5 years old. And the reason is they say we are better off, cheaper, and get better results by flipping a coin. So if you go to the hospital or you go to your doctor's office, they don't run a flu test, it's probably because they're actually trying to follow the literature. I don't want to beat up on the folks that are running the flu test, but above 5 years old, not terribly accurate. All right. So let's talk about this. We sort of talked about protecting ourselves. What's the best way to protect? For me, how do I protect myself from the flu?
Sure. 3 simple things. Get vaccinated. That is the #1 way to protect yourself. Studies consistently show when you get vaccinated, it decreases your chance of getting the flu anywhere from 60 to 90%. When they can do the educated guess and they get it right, that's the 90%. When they don't get the educated guess right, that leans toward the 60%. The problem is we don't know until after the flu season if we were right or not. So get vaccinated. That's the number one way. Number two is wash your hands. It is droplet borne, but if I sneeze and I cough, it gets onto this chair, and then Dan sits down, puts his hand here, and then touches his eye, messes with his nose, he just got exposed. Exposure doesn't mean infection, but he got exposed. Okay. So wash your hands. Third is cover your cough, cover the patient. If you know that the patient has a fever and they're coughing, put a mask on them, or if they can't tolerate a mask, they have to have a non-rebreather on, put a mask on yourself. So get vaccinated, wash your hands, and put a mask on the patient or yourself. Those are the three best ways to protect yourself from the flu virus. If you do those three things, you're well protected if you're exposed to it.
Let's go back to covering your mouth when you cough. So we used to teach people to cover with their hands, right? But you just did something there that didn't involve your hands.
Correct.
What are you doing?
Yeah. I cough, I shake your hand, I just exposed you. So cough into your sleeve. My 3-year-old right now, when she starts coughing, does exactly that because they teach that in school. So we need to be good role models also. Make sure you cough in your arm, wash yourself, all that good stuff afterwards. But yeah, that's proper cough etiquette, not into your hands. If you do cough into your hands, wash your hands.
Good to know. Good to know. Well, so the next question I'm going to answer, and then I'm going to get to answer too. Or I'm going to ask, and then I'm going to get to answer. One of the things you hear a lot about is Tamiflu. So you have the flu, you have to go to the emergency department, you have to go to your doctor so that you can get Tamiflu. What is up with Tamiflu? Well, I'm going to go ahead and raise the flag here and let you know right ahead, biased answer coming. I'm biased because I think you should only take medicine when there's a clear benefit, the benefit outweighs the side effects, and it's cost effective. I don't think Tamiflu is any of those things. Now I'm going to go ahead and admit that the CDC still says you need to consider giving it. So Tamiflu is oseltamivir. It is an antiviral agent that is theoretically specific for the flu. There have been, if you want to hear great conspiracy theories, come talk to me because I'll let you know all about the conspiracy theories and the studies. But essentially the best studies that the manufacturers can provide that show what benefit there is it can decrease the duration of symptoms by about a day. Half a day to a day, somewhere in there. There is some really bad evidence, like methodologically bad evidence, that it might be able to decrease transmission or it might decrease the severity. Might. That's the potential benefit. And that potential benefit is only there if you begin taking it early on within the course of the flu. The vast majority of patients with the flu get better within 3 to 5 days. If they're on Tamiflu, oseltamivir, they'll get better within 3 to 4 days. It costs a lot of money. And then the other issues, there are side effects. Diarrhea and vomiting. Probably between 10 and 15% of people will experience the symptoms. So it's not a benign drug. And did I mention it's really expensive? For individuals with health insurance, that's probably not that big of an issue, although there are significant copays. But from a society standpoint and a public health standpoint, that's a really expensive issue. Having said that, I still prescribe oseltamivir. I'll do it for pregnant women, and I do it for patients who are high risk, are immunocompromised, they're on chemotherapy, they have cancer, COPD. But in general, I try to let people know it's not the cure-all. It's not like antibiotics for bacteria. All right. So let's talk about, well, I'm going to skip ahead here a little bit, and I want to ask you why mean doctors don't do things. Why did that mean, nasty doctor not give me a Z-Pack for my cold?
Yeah. So you come in, you get the flu, you have a fever, you feel crummy, you probably have a cough because it's a respiratory disease. You go to the emergency room, you go to your private doctor. By golly, I paid this copay. I would like a prescription because that's the reason I paid the copay. Oh, while I'm here, give me my prescription. And I've heard this Z-Pack thing, I saw it in a magazine. Remember, flu is a virus. Z-Pack covers bacterial infections. So it's pointless. It's not going to help you get better. It's actually a bad thing because you don't have a bacterial infection. You start taking a Z-Pack, it knocks out a lot of your normal flora, your normal bacteria, and then all of a sudden you're exposed to something and you can't fight that stuff off. So your doctor's actually doing a good thing there, not a bad thing. And as healthcare professionals, we should know this, but it is a constant reminder. We hear it a lot. I went in, they didn't give me anything, and I'm mad at my doctor. There's a reason. They're actually trying to take care of you and treat what's really wrong with you, not this just blanket prescription type stuff.
I'm glad to hear you defending those mean doctors.
They're okay sometimes.
So antibiotics can have some side effects.
Correct.
Clearly diarrhea.
Yes.
I love this. Augmentin is amoxicillin plus, as you know, clavulanic acid. And the clavulanic acid is there to make sure that if you weren't going to get diarrhea from your amoxicillin, now you will from your Augmentin.
The yogurt companies love amoxicillin.
Absolutely.
So.
Yep. Yeah. All right. So I beat us up about the Z-Pack. So tell me really kind of in general, not really any specific numbers, but I'm transporting a patient with the flu. And what is my danger?
Sure. Pretty low. You're just a typical flu patient. You walk in, they're not actively coughing all over the place. They just feel crummy. Their body aches. They're a little dehydrated because they hadn't been up and drinking and stuff like that. You transport them. They're not coughing a whole bunch. They have a fever. You rehydrate them with some IV fluids and stuff. Really not an exposure, because remember that flu is a droplet. So they have to cough, they have to sneeze, and it has to get on you, in your eyes, in your nose, in your mouth type thing before an exposure happens. Again, exposure does not mean infection. So your chances of getting the flu from just interacting with somebody with the flu is pretty low, especially if you've been vaccinated, you wash your hands, and you put a mask on the patient or yourself. If you do those three things, you had no exposure. So you're transporting a patient and they cough just like that, or they cough a little bit more forcefully and it gets in your face. What do? There's not a whole lot you can do. You've been exposed at that point, but again, exposure doesn't mean infection. So again, wash your hands, wear the mask, do preventative type things before you have to actually respond to the flu type deal. So your chances of getting the flu from transporting somebody pretty low. Everybody out there has transported somebody with the flu and you didn't get it. You've interacted with probably hundreds of patients in the ER. You don't have the flu. Okay. So exposure doesn't mean infection.
Fair enough. And I did get my flu shot.
There you go.
So when you talk about masks, are we talking about a level 5 hazmat suit mask? Or?
Not at all. Surgical mask works fine. If you only have an N95 mask, put an N95 mask on them. Just remember, N95 mask for respiratory, and we're talking about a respiratory disease, it's hard for the patient to draw air through an N95 mask, so that might be a case where you have to put the N95 on yourself and also your first responders and your partner. Okay. But a simple surgical mask on the patient is fine. You can put that on even with a nasal cannula on, the end-tidal and everything else. You can put a surgical mask on somebody. So
really we're just trying to prevent the airborne boogers.
The spray of going out. Remember, it's droplet borne. I just want to prevent this length going out.
Perfect. All right. So let's say I do get the flu because I didn't get my flu shot, and I'm out, I don't know, licking people's hands as they have been sneezing into them. I get the flu. What's the best way to protect my family and take care of myself? You mentioned the things for me to do, hydration, analgesics, that kind of stuff.
Yeah, I mean, and it's symptom stuff as far as if your family member gets it, you get it. It's just symptom control. Antipyretics, Tylenol, Motrin, whatever you choose. Hydrate as much as possible. So how do you prevent other people from getting it? If your child has it, try to, again, arm's length away from them. Good cough etiquette. Washing your hands, everybody's hands constantly at the station, wiping stuff down. Simple, the scrubbing bubbles that we have kills the flu virus. The Lysol that we have, spray it around, it kills the flu virus. Remember with Lysol, spray it, leave it, don't wipe it up type thing. Those are ways that you can do that. But again, vaccinate, hand washing, cover your cough or put a mask on them. That's the best way to prevent it from spreading around. And then just simple decontamination will take care of the flu virus. Flu virus isn't very hardy. It doesn't hang around forever and ever. So just be careful what you handle. The patient sneezes into a tissue, get rid of the tissue, put it in the trash. Remember, that's in the trash, so when you empty the trash, go wash your hands. Don't empty the trash and go eat your burrito and pick your nose and stuff. That's bad stuff.
Okay. All right. Now, if I get the flu, I'm running fever, when can I, presumably I shouldn't come to work.
Yes, yeah, if you have, I know where you're going. If you have a fever, don't come to work. The bad thing about the flu is you're actually shedding the virus a day before you get the fever, before you feel the symptoms, so you don't know. So you can actually come to work and still expose people. But if you're running a fever, don't come to work. When can I come back to work, or when can you come back to work? You have to be fever-free, no fever, 98.6, 100.5 technically, but we'll go 98.6, no fever for 24 hours without the use of those antipyretics. no Tylenol, no Motrin. Okay. You can't go, well, I took Motrin at 8 o'clock last night and I feel fine at 7 o'clock in the morning. I don't have a fever. No. Okay. 24 hours, no antipyretics, then you're ready to come back to work then and care for patients. It's a patient safety thing is what we're looking at, because we deal with people with cancer that are immunocompromised. We don't want to threaten those patients.
Okay. All right, fair enough. And is there, while I have the flu, so I'm avoiding my patients, in my family, is there any particular population of, like anybody in my family I might want to avoid more so than others?
Sure. Immunocompromised, if you have a family member that's obviously receiving chemotherapy or some type of immunosuppressant therapy, that's not a good population to be around. Kids, less than 5. Okay. People with comorbidity things, severe cardiac disease, other respiratory issues, things like that. You want to try to avoid those as much as possible. Sometimes pregnant people is a great one. You want to try to avoid them. Those ladies also, because
you should avoid the pregnant men too.
Yeah,
just to be
exactly.
clear.
That's a little weird. So you don't want to expose those people, those high risk populations of getting, if they get the flu, something bad can happen. It's those populations: kids, elderly, immunocompromised, pregnant ladies. Those are the ones we want to avoid.
All right. Well, I think that covers most of the questions I had. I think that pretty much hits most of the questions that I've been getting about the flu. Is there anything else that you'd like to tell us about the flu?
If you want the vaccine, we still have plenty of vaccine available. Remember, the vaccine, the shot, once you get it, it takes about 2 weeks before you get full immunity, so to speak. You do have some pretty quick immunity to it, but it takes about 2 weeks. Flu activity is the highest in February, so we're just starting right now. So if you're going to get the flu vaccine, get the flu vaccine now. Call Joe in the office, 512-943-1260. Set up a time, go in and get your flu vaccine. If we run out there, we'll send you over to the health department to get the flu vaccine. Okay. No cost to you or anything like that. So get the vaccine, wash your hands, and wear a mask or put a mask on the patient. Let me back up to the washing your hands thing. How long do I have to wash my hands? Sing the ABC song in your head. That's how long. Seems like a long time, but wash your hands a long time. Make sure you get up to about in this area when you're washing your hands. Anytime you handle anything in the ambulance, do that. So immunize, wash your hands, mask.
That ABC song always takes me a long time. I can never figure out what comes after M.
It's because you're an Aggie.
See, I knew there was a reason. Well, Mike, thank you very much for coming in. Great information.
You bet.
So the one thing I'd like to end with, hopefully before Dan presses the end button, is if y'all have any suggestions for future interviews, please let us know. We'd be happy to cover topics that you're interested in, and we'll be happy to get subject matter experts to come in and chat with us. Well, thank y'all very much.